Welcome to day 3 of the New to Medicare Bootcamp. In total, there are 5 straight days of topics, and all the topics are in the best order for those learning about Medicare for the first time. This bootcamp saves you tons of time and research, and each day's topic builds on the prior day. So by the end of the week, you have all the puzzle pieces in the proper order, and you'll know your next steps. I'm Pam Turner, the creator and facilitator of the Medicare Facebook group known as Navigating Medicare the Easy Way. I help you to put aside all those fears and worries about getting onto Medicare and enrolling in the right plan by streamlining the whole process for you. I often mention how it's better to go on an information diet. When you start this process, it's better to take in less information, not more. You want to take in the right information in the right order. Today's topic is why there's really only 2 options on Medicare and how to choose a plan, with a quick bonus topic at the end, Plan G versus Plan N. Grab a piece of paper if you haven't already. There's a section in today's presentation where you may want to take some notes. If you're new to Medicare and just getting started researching, it probably feels like there's hundreds of options to choose from. What if there was only 2 options to choose from? I'm going to show you how easy this can be. Everyone I talk to is in the exact same boat. Just know that you're not alone, and it's not just you that's totally overwhelmed and confused. This system has gotten more and more convoluted over the years, and a big part of what makes it so complicated is due to the privatization of Medicare through the Advantage Plan program. And not to mention all the potential profits that can be made by large insurance agencies. Because of this, there's been an explosion over the last at least 5+ years of these huge agency call centers looking to gain massive profits by exploiting some of the Advantage Plan benefits to lure people in. And they do this by capitalizing on your confusion. They use misleading telemarketing tactics and misleading advertising. They use the confusion to their advantage because they know this is a weakness and that they can wear you down. It makes you just want to give up and buy the first thing that comes along just to get it over with. But it doesn't feel good when you don't even understand what you signed up for. So I'm going to show you how there's really only 2 options and how easy it can be to tell them apart. The 2 plan types you can choose on Medicare are Medicare supplements known as Medigap plans, and I'll refer to them as Medigap as we go along, and the other is Medicare Advantage plans. Part of the reason why everything feels so confusing is that there's so many moving parts labeled with letters. You have the government parts labeled A, B, C, and D. You have Medigap plans A through N. I'm going to clear all this up. When it comes to original Medicare, unless you have a qualified reason to hold off, you have to go ahead and get Parts A and B. Everyone has to get Parts A and B in order to choose some sort of supplemental coverage, and everyone gets the same Part A and the same Part B. Unless you're still working, and that's another whole topic, which I covered the last 2 days. If you need a refresher, go back to bootcamp days 1 and 2. I'll explain where the options come in a little bit. Some people think that the supplements are Part B, but that's not true. You don't have choices when it comes to Parts A and B. You have to sign up for both parts of Medicare to be eligible to enroll in one of the 2 plan types I'm talking about today. No matter what supplemental options you end up choosing, you must be enrolled in both Parts A and Part B, and you must keep paying for your Medicare Part B. So here's where the 2 options come in. You can either add a Medigap plan to your original Medicare, which means your original Medicare stays intact, or you can choose to get your Medicare through an Advantage plan. There are really only these 2 types of plans. Every ad you see, every piece of mail that you get is either talking about one or the other. Your drug plan won't factor in until later. What I mean by this is you don't add your pharmacy drug coverage at the same time you sign up for Parts A and B. The way you get your drug plan is based on which of the 2 plan types you go with, which I'll talk more about in a minute. The easiest way to navigate through this is to start out by understanding the 2 plan types first. This is the process that I take everyone through that decides to work with me. These plan types are complete polar opposites of each other, and most people find themselves naturally gravitating toward one or the other. Your job will be first to understand the difference between these 2 plan types and then decide which one you're leaning toward. In order to compare these 2 plan types, I'm going to go down a list point by point of how they're different from each other. And if you want to follow along on a piece of paper and take notes, you can make 2 columns, one side that says Medigap at the top and the other that says Medicare Advantage at the top. I'll tell you what to write down under each side as we go. So far, under the Medigap side, you can write keeps original Medicare, and under the Advantage side, replaces original Medicare. With an Advantage plan, you're still on Medicare. It's just a different way to get it. The rules of the Advantage plan override the rules of Medicare to a certain extent, so you have to pay attention to the rules and regulations of your Advantage plan if you sign up on one. That's why the government requires agents and brokers like myself to get permission before even discussing the specific benefits in a client appointment, because the plans are easily misunderstood and because there's restrictions that can really affect people. So you can already see how these plans are polar opposites. One keeps your original Medicare in place, and the other takes over your Medicare benefits through a private insurance plan. Medigap plans are called what they are because they're filling in a cost gap. When you choose a Medigap plan, you stay on original Medicare and pair it with a Medigap plan. Your original government Medicare pays their portion of the bill, and the Medigap plan pays the rest of the bill. The Medigap plan is covering your out-of-pocket costs for you. Advantage plans are the opposite because the private insurance plan is now paying the doctors, not the government. Next, I'm comparing the monthly cost of the plans known as premium. Medigap plans typically cost between $100 and $200 per month, and it could be less or more depending on which plan letter you choose and where you live and your age when you sign up. Advantage plans are often zero monthly cost to you as far as premium goes. In both cases, you keep paying for your Medicare Part B. In your notes under Medigap, you can write higher monthly costs, and under the Advantage plan side, low or zero monthly cost. Next, comparing copays. Now, I'm using copay as a loose term here just to represent what you pay out of pocket for your medical. Medigap plans pick up the majority of your out of pocket, so you have little to no additional cost once you meet the small Medicare deductible. Advantage plans are set up so that you pay copays as you go. So you can see how this is going. You can see there's a polar opposite trend going on point by point. In your notes, you can write under Medigap, pay upfront as monthly premium, and under the Advantage side, pay as you go. I'll say that one more time. I know this might be a lot to write down. Under Medigap, pay upfront as monthly premium, and under the Advantage side, pay as you go. Next, let's compare the freedom to see any doctor. Medigap plans allow you to see any doctors that accept Medicare, while Advantage plans require you to stick to a doctor network. Even if an Advantage plan says PPO in the title, you're not guaranteed that the out-of-network doctor will accept the plan. A lot of people don't realize this. So you can write in your notes under the Medigap side, more freedom of providers, and under the Medicare Advantage side, less freedom of providers. That one was pretty straightforward. So you can see through this comparison that Medigap plans cost more. They offer more predictability and overall lower out-of-pocket risk, but you're paying monthly whether you use the plan or not. On the opposite end of the spectrum, Advantage plans cost less, or zero monthly, are less predictable, and you'll have an overall higher out-of-pocket risk, but you can save month to month if you're not using the plan. I know this makes Advantage plans sound pretty great, but you have to keep in mind that most states require you to answer health questions to get approved on a Medigap plan after your new to Medicare window. So you can see where I'm going with this. If you start out with an Advantage plan, you may not get back to Medigap. So you'll need to decide if this is going to impact your decision making when you're first eligible. The way to get your Part D coverage is also completely opposite for each plan type. If you decide a Medigap plan suits you better, you'll need to buy a separate drug plan. If you decide that a Medicare Advantage plan is better for you, you'll find that the drug plan is already bundled into your Advantage plan. In your notes under the Medigap side, you can write must buy separate drug plan, and under the Advantage side, drug plan bundled in. Once you choose one or the other of these two plan types, the hard part is behind you. You do have options within these plan types, but it doesn't need to be as overwhelming as you might think. Next, we're going to talk about risk. When I use the word risk, I'm usually talking about the risk to your finances. In other words, what's the worst case scenario of costs you could be facing in a year? The way you measure this with a Medigap plan is you add up the monthly cost of the Medigap plan and then any out-of-pocket expenses such as the Medicare deductible. That's the most you would pay in a year for your medical expenses. The only thing that remains unknown is how much will your Medigap plan go up over the years. The way you measure risk on an Advantage plan is you look at the max out-of-pocket number. Every Advantage plan has this number set at the beginning of the year. For instance, Medicare this year allows it to be as high as $9,350, so this could be your maximum financial risk on some plans, but most plans do keep it lower. This is definitely an important number to look at when you're looking at a summary of benefits for Advantage plans. We're not considering your cost for Medicare Part B in this plan comparison because it stays constant no matter which plan type you pick. Other areas of risk can include things like being restricted on what doctors you can see or needing a prior authorization for certain medical tests or procedures on an Advantage plan. In your notes, you can write down that Medigap has less out-of-pocket risk and Medicare Advantage has higher out-of-pocket risk. Next, I want to talk about how to switch from one plan to the other. This is important, especially if you go through this whole process and you still aren't sure which one you want. You may want to try one or the other out first and like the idea of being able to switch later. But how do you know what's allowed and if you'll be able to do that? So this is why I wanted to bring this up. If you buy an Advantage plan, there's a law in place that lets you have a 1-year trial on the plan if your Medicare Parts A and B both started at the same time at age 65. I know this may not apply to a lot of you that start your Part B later, unfortunately. It doesn't seem fair. Anytime in that first year, you can drop it and get a Medigap plan with no health questions. After the first year, in order to switch, you'd have to wait until the fall open enrollment when you can drop your Advantage plan. Okay, now this would apply to anybody that wants to just get a Medigap plan from an Advantage plan. So here's the process. Now this is later on down the line when, you're already outside of your regular window, or you're new to Medicare window, I should say. So the process is that you apply for the Medigap plan first during the fall open enrollment to see if you pass the health questions. Once you pass, then you drop your Advantage plan before the deadline in December. If you want to switch from Medigap to an Advantage plan, there's no health questions, so there's nothing blocking you. You just have to wait until the fall open enrollment when you can join the Advantage plan, and then you would cancel the Medigap as of January 1st. Next, how do you decide which plan is the best fit for you? I highly recommend checking out my free workbook if you haven't already. To request it on my website, you can access the workbook request by going to Decoding Medicare.com and looking for the workbook under the free resources tab along the top. Near the back of this workbook PDF, there's a side-by-side comparison of all the characteristics that we just talked about, and there might be a few more added in there as well. It's set up in 2 columns side by side so you can compare Medigap and Advantage point by point on paper. You can ask yourself questions like, how important is it to me to see any doctor? Or could I be flexible if I had to be? Most people are able to find an Advantage plan that works with their providers, but there's no guarantee that you'll always be able to see your doctors under the plan you choose. It's appealing to a lot of people to save on the monthly costs, so having the lowest possible monthly bill for your plan may be more appealing to you in exchange for some risk. Some people are really uncomfortable, though, with the financial risk, and some are not bothered by it much at all. So you can just think it through and ask yourself, would I lose sleep over this or that plan? So that's what I recommend. I have clients that do love the idea of paying as little as possible for their insurance, and they don't worry about risk at all. These are the types of things you'll think about when you're deciding which plan type to choose. I encourage you to book a call with me so I can take you through this process so easily, bypassing all the time and research you'd have to do it all on your own. Also, getting the pricing for the Medigap plans and getting more details on the Advantage plan benefits on a call with me can really go a long way in helping you to decide. And finally, what are some of the things no one talks about? If you've ever worked with someone really intent on selling you an Advantage plan, I'd be willing to bet that they don't talk about how you may never qualify for a Medigap plan again, that you only get one free shot to get on a Medigap plan. That's kind of important, wouldn't you say? Maybe it doesn't matter to you if what you really want is an Advantage plan anyway, and that's fine, but still, you deserve to know this information. There are several things about Advantage plans that don't get mentioned much, if at all. For instance, you need to look on the summary of benefits for anything that has a percentage. For example, if you need chemotherapy, infusion therapy, injections, you pay 20%. Well, 20% of what? See what I'm talking about? You really don't know how high your risk is. The only thing that you really are going to know when it comes to one of these percentages is that the cutoff is your max out-of-pocket number. So that's where the risk comes in. Advantage plans work for a lot of people, but you deserve to know the whole truth about them so that there's no surprises later. The more you know about a plan and what's best for you, the more confident you'll be about the choice that you end up making, and you'll be able to better plan for the unexpected. Now for our bonus topic, Plan G versus Plan N. Now, I just taught you everything you need to know before you even consider a Plan G or a Plan N, because Plans G and N, they fall under the Medigap side. They're both Medigap plans. So if you're leaning toward a Medigap plan, this may help you with the next steps because you'll have to decide which Medigap plan to go with. When you have a Medigap plan, there's no doctor network. This equals more freedom for you and no referrals to see a specialist. So let's do a quick comparison of Plan G versus Plan N. Plan G is now the highest highest level of coverage someone new to Medicare can buy. Plan G covers all of your out-of-pocket expenses on Medicare except for the small deductible you have to pay on Medicare. It's known as the Part B deductible, and it's $257 this year. That means when you have a Plan G, you only have to meet the $257 in medical costs. Then you have no further out-of-pocket for the entire year except for your drug copays if you have any, or anything that's not covered by Medicare. Plan N starts out the calendar year exactly the same way. On a Plan N, you also have to pay the Part B deductible of $257. However, unlike Plan G, you're required to pay a copay for office visits. This copay is up to $20 for just the office visit portion, and you pay $50 for emergency room. All other services are covered, such as tests, surgeries, hospital lab work, just like Plan G. The only thing that Plan N doesn't cover that Plan G does is something on Medicare known as excess charges. If a doctor doesn't accept the Medicare approved rate for a certain service, they can upcharge 15%. You can find out in advance whether or not a doctor charges this, and you'll find out that it is pretty rare. I don't get clients telling me often, if at all. I don't know if I've ever had someone tell me that they have received an excess charge on a Plan N, but it is out there. So, and this is part of the benefit of the Plan N, that it's not covered. Now, it is covered on a Plan G. However, if you live in the following states, excess charges are outlawed or limited, so Plan N would be an even better value for you. The states are Connecticut, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. In Massachusetts and Minnesota, they don't have a Plan N, but they have something very similar, and they don't allow excess charges in those states. Wisconsin does allow the excess charges, but doesn't have a Plan N or a G. However, the Wisconsin versions are very comparable. They just have a different name. I have availability to help you through this process. There's no reason to have to struggle through it on your own. I can help you find the right plan for you, even if you're starting at square one and you feel like you don't know anything. I get you up to speed on how Medicare works, how to enroll in Original Medicare, and transition off a work plan if that's your situation. Then I teach you everything we just went over, and we can look at specific pricing and benefits for the Medigap and the Advantage plans in your area. This is an extra step that makes it so much easier to make a decision on which plan type is your ideal plan. Also, many agents or brokers don't always help with the drug plans. It's something that is definitely not a moneymaker for us, but is probably the number one necessary aspect of support needed with Medicare these days, because the plans change every single year and it can get more complicated as you age. So it's good to start out with a broker now that you know can handle the changes happening with your drug plan over the years. So do yourself a favor and reach out to me to get the help you need. It's always 100% free from start to finish. You can access how to get booked on my calendar on my website. When you go to decodingmedicare.com, just visit the contact page and you'll be able to see my availability and book a call there. I hope to see you for Day 4's topic. Day 4 is what is Part D and where does it fit in? Enjoy the rest of your day, and I will see you in the next video.